Clinical documentation in itself is important because it provides a record of the care that's provided, serves as a witness in a malpractice claim, is used for billing purposes, and maintains a continuity of care record for the patient. It's especially important in telehealth, though, because the patient is not in the office. The patient is somewhere else. And so there are things that we will need to know that need to be documented in the record that wouldn't happen in an in-person visit. The physician has to be licensed in the state where they are practicing and also in the state where the patient is. So it's very important to document where the patient is receiving the care in their home and their geographic location, so that we can demonstrate that the care that's being provided is appropriate from a regulatory perspective as well as a clinical perspective. Informed consent is really important in telehealth. It's not quite the same as the informed consent that a physician would get when they were doing a procedure. It's more explaining to the patient the risks and benefits of receiving healthcare remotely. So some of the risks are the patient might be too sick for a telehealth visit, and they need to know ahead of time that if the doctor makes that determination, the patient's going to either have to go to an urgent care center or an emergency department or come to the office for an in-person visit. The next thing that needs to be considered and discussed in the informed consent is the additional risk of electronic privacy and security. So in an office setting, all of the equipment has been carefully checked to make sure that it meets all the federal and state requirements for privacy and security. But a provider doesn't have that control over the patient's home equipment. So they have to discuss those risks with the patient and make sure that the patient is willing to accept the risk of having a telehealth visit using their own personal equipment and their internet access.